I'm Sheila Larson, and this is Ozzy. He's my dog. He's going to help me demonstrate the skeletal system. First of all, I'm going to start off with the bones of the skull. I'm going to start off with the incisive bone, which makes up the most rostral bone of the skull. It houses the incisor teeth. Then I'm going to move to the nasal bones. There's two of them, they make up the bridge of the nose. The maxilla, there's two maxillary bones, they make up most of the upper jaw. The temporal bones make up the lateral walls of the cranium on the side here and house the middle and inner ear structures. The external auditory meatus is the only external ear structure that is visible from the outside. The frontal bone makes up the forehead region. Good boy, Oz. It's located just rostral to the parietal bones. The frontal bones are the location of the frontal sinuses. The parietal bone makes up the dorsolateral wall of the cranium, and then the mandible is the lower jaw. The body of the mandible houses the lower teeth. The ramus of the mandible is at the caudal end of the mandible. It's where jaw muscles attach and where they make up the temporomandibular joint right here, which is the joint that allows for the jaw to open and close. Good boy, Oz. The occipital bone is the caudalmost bone of the skull. It's located right at the back. The foramen magnum is a hole in the occipital bone where the spinal cord exits the skull. Back at the front, in the sinus cavity, are four bones called nasal terminates. They warm and trap air, and they warm and humidify air, and they trap tiny particles that are inhaled. Now Ozzy and I are going to demonstrate the different parts of the vertebral structure. The spinal column is separated into 5 different sections, starting with the cervical, thoracic, lumbar, sacral, and coccygeal. Starting with the cervical vertebrae, C1, also known as the atlas, has 2 large protuberances out the side, also known as the wings of Atlas. C2, also known as the axis, has a large blade-like spinous process. There are usually 7 cervical vertebrae. The thoracic vertebrae are located dorsal to the thorax. There are usually 13 thoracic vertebrae. They are known for their tall spinous processes. The spinous processes are the most dorsal protrusions on a vertebrae, and in the thoracic region they are very pronounced. A vertebrae also has transverse processes, but that are located laterally, but you can't feel them in Ozzy because they're covered by muscle. There's usually the same number of thoracic vertebrae as there are pairs of ribs. And then moving down into the lumbar section, the lumbar vertebrae have short spinous processes, and there's usually 7 lumbar vertebrae. They make up the lower back. They have large bodies because they need to be able to support the weight of the abdominal organs without the support of the ribs. The sacral vertebrae, there's usually three. They're dorsal to the pelvis. The three vertebrae are usually fused into one structure called the sacrum. And then the coccygeal vertebrae make up the tail. There's a variable number of coccygeal vertebrae in dogs. Ribs are the flat bones that make up the walls of the thoracic cavity. There are usually 13 pairs of ribs in a dog, so 26 ribs total. They go down to form with the sternum, which is the floor of the thoracic cavity. The bones of the sternum are called sternebrae, and the ones that we are most concerned about are the manubrium, which is the cranial-most sternebrae, and the xiphoid process, which is the caudal-most sternebrae. Ribs are separated into the dorsal bony section and the ventral cartilaginous section. The point where the bone meets the cartilage is the costochondral junction. Ozzy and I are now going to go over the bones that make up the thoracic limb, or the forelimb. So starting off with the scapular or shoulder blade, which runs from here to here. It is the most proximal bone of the thoracic limb. The scapula has a spine, which is a lateral protrusion or longitudinal protrusion that runs from here to here. Then we move on to the humerus, which is the long bone that makes up the upper arm. It runs from here to here. You can feel the greater tubercle here, which makes up the cranial aspect of the proximal humerus. Then going down to the main weight-bearing bones of his forearm, which is his radius, which runs from here to here. It is cranial to the ulna. The ulna is caudal to the radius. The ulna has an olecranon process, which makes up the point of the elbow. Then it goes into his carpus, or his wrist. There are 2 rows of carpal bones, and then it goes to metacarpal bones. There are 5 metacarpal bones in the dog. They are numbered medially to laterally. 1, 2, 3, 4, and 5. And then it goes into his digits. The digits are made up of phalanges, and with the exception of the dew claw, they are made up of 3. So they are numbered proximally to distally. So P1, P2, P3, or proximal phalange, middle phalange, and distal phalange. Ozzy and I are now going to go over the different bones that make up the pelvic limb or hind limb. Starting off with the pelvis, there are 3 bones that make up the pelvis, starting with the ilium, which is the cranial-most pelvic bone. It has the wings of the ilium are commonly referred to as the hip bones, and then going down to the ischium, which is the most caudal bone of the pelvis. The ischium has an ischial tuberosity, which is the most rear projecting. It's the most main rear projecting process of the ischium. The pubis is the smallest of the pubic bones. It is located medially, in between. I can't really feel it on Ozzy. The acetabulum is the socket part of the ball and socket joint that makes up the hip, and the obturator foramen foramen are large holes that if we were to go through, they're large holes and their main purpose is to lighten the pelvis. And then moving on, the long bone that makes up the thigh is the femur. It runs from about here to here. The proximal end of the femur has a head, which is the ball part of the ball and socket joint that goes into the acetabulum. And then opposite that is the greater trochanter. And then when we move down the femur, we get to the stifle, and here is the patella, which is the kneecap. It is the largest sesamoid bone in the body. And then we have the tibia, which is the weight-bearing bone of the pelvic limb. The tibial tuberosity is the cranial aspect of the proximal end of the tibia, and the tibial crest is where the patellar ligament attaches to the tibial tuberosity. The fibula is a thin but complete bone located caudal to the tibia that runs down to the tarsus. The tarsus, also known as the hock, is made up of 2 rows of tarsal bones. The calcaneus is the tarsal bone that makes up the point of the hock. In the pelvic limb, there are only 4 metacarpal bones, again numbered medially to laterally. 1, 2, 3, and 4. And then it goes down into the digits. And again, there's only 4 digits on the pelvic limb. And the digits are also numbered medially to laterally. 1, 2, we number it as though there's a dew claw, so 1, 2, 3, 4, and 5. And they are also made up of 3 phalanges. So P1, P2, and P3, or proximal phalange, middle phalange, distal phalange. And I are now going to demonstrate where you would palpitate for different lymph nodes. Starting off with the parotid lymph node, which is around the base of the ear, and then the mandibular, which is under the jaw. We can move down to the prescapular lymph node, which is located in front of the scapula. And then the axillary, which is in his armpit. And then moving back, we go to the inguinal lymph node, which is in his groin. And then we end with the popliteal lymph node, which is found at the back of the stifle, and about here. And those are some of the common lymph nodes.